Hi, I'm Suzanne Mouton-Odum, and I'm a clinical psychologist. And I'm going to talk to you today about the comprehensive behavioral model for BFRBs, hair pulling and skin picking. But I'm going to focus on the motor domain. And the motor domain is the M, obviously, in the SCAMP model. And motor really stands for two things. So the motor covers motor movements. So oftentimes with hair pulling and skin picking, there are motor movements that are associated with the behavior. For example, with hair pulling, it might be stroking the hair or feeling the eyebrow or eyelash prior to pulling. With skin picking, it might be touching the skin, rubbing, some sort of a motor movement. Now, sometimes it has to do with where you are and the activity you're engaged in. For example, if you're watching television, you might be sitting on the couch with your arm up and your hand here or your hand here. And so motor can also refer to sort of positioning, where you're sitting, where your arms are, but these are sort of unconscious or subconscious motor movements that happen outside of our awareness oftentimes. So in working with people, we try to increase awareness. And so the second half of the M is kind of the awareness piece. And we want to look at how aware a person is of their behavior. And if there are some motor movements associated with pulling or picking, we want to understand what they are. So for example, if pulling always is preceded by hair stroking or maybe searching for a certain kind of hair, we want to call attention to when the hand goes up and starts touching the head. Because if we can interrupt or interfere with that movement, ultimately we can change the outcome. And so oftentimes in working with the motor domain, we're really working with increasing and enhancing awareness. Where are my hands? What are they doing? What are they touching? And am I engaged in a precursor behavior to hair pulling or skin picking? Another thing about awareness, it's often talked about in the literature, is that people are either pulling sort of automatically versus focused. And what that refers to is automatic pulling is when it happens, or picking, when it happens outside of one's awareness. So this might be you're driving your car, reading a book, working on the computer, and just sort of pulling or picking or biting or picking fingers outside of one's awareness versus focused pulling or picking, which is when one's attention is focused on that behavior. So for example, someone might be in the mirror, looking at the mirror and scanning their face and engaged in sort of pimple picking or removing blackheads, or so the focus of the behavior and of the attention is on the behavior, if that makes sense. The problem is most people engage in both. Sometimes they're aware and focused on the behavior, and sometimes it's outside of their awareness and it's more automatic. So that's somewhat helpful in treatment, but I think what's more helpful is to understand sort of what's behind the behavior and how we can intervene, for example, with the motor domain, which is what I talked about today. Okay, bye for now, and see you soon. Thanks.